A new study shows approximately 1 in 7 people in the UK have antibodies to COVID-19, while 91% of Pfizer vaccine recipients have them. Also, as Italy increases its vaccination rate, Israel looks to reopen its economy by April. Our Seung-jae has a wrap-up.
According to the latest study into the effectiveness of the Pfizer-BioNTech vaccine, roughly 1 in 7 people in the UK have developed antibodies to COVID-19. The study involved 154,000 subjects, including more than 17,000 who had received at least one dose. Further research also shows that 91% of people who received 2 doses of Pfizer's vaccine had developed antibodies, which rises to 95.5% in people under the age of 60. It added that those aged 80 and older had an 88% chance of forming antibodies. The youngest group, those 30 and under, had a very strong level of antibodies at 94.7% just 3 weeks after their first dose. Over in Italy, the country's virus czar has praised the country's vaccination program, noting that inoculations showed a comforting increase this week, averaging around 100,000 a day nationally. This comes as Italy's northern Lombardy region asked the national government Thursday for more vaccines to help stem a resurgence. Italy on Thursday added nearly 20,000 cases, the highest daily number since early January. Israel, which has been by far the most aggressive country when it comes to vaccinating its people, has announced its plans to reopen its economy in the near future.
In the 4th stage, at the end of March, our intention is to finish vaccinating the adult population over the age of 16. In April, our intention is to fully reopen. For sure, this depends on the level of infection, but if we all do what we should do, we can pass through this.
Last Sunday, Israel reopened many of its businesses, including leisure facilities, but only to those who have been immunized or for those who have recovered from COVID-19. The country has administered at least 1 dose of Pfizer's vaccine to nearly half of its 9 million population so far. Seung-jae, Arirang News.